A pleasant morning, afternoon, or evening to you, everyone. We are the BSN 2G Group 4 Mommy On You Followers Bulacan chapter, and we will be discussing to you the ICT in medicine. Proceeding with the objectives, so by the end of the discussion, the students are expected to first, to understand the role of information and communication technology, or ICT, in the medical field. Two, to identify key ICT tools used in healthcare, such as electronic health records, telemedicine, and mobile health apps. Third, to explain how ICT improves patient care, diagnosis, treatment, and monitoring. Fourth, to explore the impact of ICT on healthcare accessibility, efficiency, and data management. Fifth, to recognize the contribution of ICT in advancing medical research and hospital operations. For the content outline, the contents of the presentation are the following. First, the introduction. Second, the importance. Third, the key application. Fourth, challenges and limitations. And lastly, conclusion.
So, hello, I'm going to discuss introduction of ICT in medicine. So, ano nga ba yung ICT? So, ICT refers to a broad range of technological tools used to create, store, manage, transmit, and exchange information. So, this includes computer, mobile devices, yung phones, laptop, and tablets, yan, internet platforms, software application, digital communication system. So, over the past few decades, ICT has become an essential part of our lives, where it influences how we work, how we learn, and even interact with other people. So one of the most transformative areas where ICT has made a significant impact is in the field of medicine. So ano nga ba yung mga naging impacts nito sa healthcare? So first is we have the revolutionation how medical professionals and doctors to diagnose and treat, monitor patients. So also we have the EHR, the electronic health record, where it allows efficient documentation and instant access to patient histories, reducing the errors and improving continuity of care. Next is we have the telemedicine, where it enables doctors to consult with patient na nasa malalayong lugar, breaking geographical barriers and making healthcare more accessible, especially nga yung, sa mga taong nasa rural and underserved areas. So, next is ICT supports medical research by enabling faster data analysis, yung collaboration between institution worldwide, and access to a vast medical database, and healthcare information system, which helps hospital to manage resources more effectively, and yung mobile health application na nag-empower sa mga patient na ma-monitor nila yung own health records through monitoring and reminders. Thank you.
Importance of ICT in healthcare. Because of ICT, healthcare services were able to adhere to the latest updates in the field. And as we know, all things are bound to change as time passes by. And it is the same thing in the field of medicine or healthcare. A lot of things changed since then, and these changes are for the better. The managements, treatments, policies, and even medications are changed in a safer way, much cost-efficient and faster application. So next, efficient and flexible management of patient information. So unlike the traditional way of managing patient information, the ICT provided ways in order to bring efficiency in the area, bringing the healthcare team a more accessible interface to access the information. So instead of using a lot of time searching and searching, they can just scroll or type certain keywords, and then there, the information is in front of you. Next, modernized way of communication among the healthcare team and patient. So the innovations of ICT and communication really helped a lot in the area. It saves time and effort of going into each other's area or department just to say something, exchange information, and so on. Of course, it's also done to carry out orders. Now, they can just use devices in order to communicate with each other and exchange information that they need. So, next one for the utilizes or saves time and effort, also cost in certain circumstance. So we had this time in pandemic when people are really afraid or were really afraid to go out because of the stigma of the COVID. So this time telemedicine really helped people to get consultation online. So during that time, the patient can express their symptoms, what they feel, and they can ask questions to the physician digitally. So that time they can get consultation and management from the physician, and it saved them time and effort of going to the hospital, and the cost of transportation were also removed because online. Maybe that time the mode of payment is of course online through e-wallet or online transaction. So that time. So it saved them time and effort, and of course it guaranteed their safety because they won't be exposed anymore. Or although it will not guarantee their safety at home, it will decrease the risk of getting infected that time. So it is much safer to do online consultation and so on.
So good day, I'll be talking about the information and communication technology as well as its underlying significance. So ICT plays a crucial role in the modern healthcare as it enhances the communication as well as the collaboration within those healthcare professionals. So we have the tools like electronic health records, we also have the telemedicine platforms and secure messaging systems, which is significant basically because it allows the doctors, the nurses, as well as the specialists to quickly share the patient's vital information regardless of the location. So this seamless exchange of data helps ensure that everyone being involved in a patient's care is not only updated but also within the same page. So ICT also significantly speeds up the decision-making processes because this really plays its role within the clinical settings. With the immediate access to the test results as well as the medical histories and the treatment plans, the doctors can make faster and make more accurate decisions, meaning to say, this can help reduce the chances of the medical errors. And also, the tendency is that it can lead to a safer and more effective form of patient care. So, moreover, the ICT ensures a coordinated and continuous care, which helpful, especially for the patients who are having a chronic illness or those who are having a long-term treatment. This allows the healthcare to track the progress over time and also maintain consistent care, even if the patients visit different forms of locations. So perhaps one of the most impactful benefits of the ICT is also highlighting and emphasizing its impactful benefits because this really provides an improved access of the healthcare as it provides not only with the rural but also within the remote areas. So through the telemedicine, this is helpful because the patients can consult with the specialist without having to travel long form of distances. So this is essential because we can save time and also the cost while still receiving the high quality form of care. So overall, ICT is significant because it transforms the healthcare into a more efficient, a more effective, and efficient form of centered system.
Good day everyone! Today we will be talking about how technology is improving patient care. First, let's talk about electronic health records or EHRs. These are digital versions of patient's paper chart. They store important health information like medical history, medications, lab results, and more. EHRs are updated in real time, which means doctors and nurses can access accurate information quickly. This helps reduce medical errors and improves the quality and safety of patient care. Next is telemedicine. This allows patients to consult with doctors through video calls. It's especially useful for those who live far from hospital or clinics, and during times of outbreaks because it prevents the spread of communicable diseases. Next is the mobile health apps. These apps can be installed on smartphones and are used to track a person's diet, physical activity, and specific health conditions. They also provide easy access to information about various diseases, as well as lab results, prescription, and visit history. The next one is the wearable health devices, like smartwatch can monitor sleep, calories burned, and vital signs such as heart rate and oxygen levels. These are very helpful for people with chronic conditions who need regular monitoring.
Thanks to ICT for having the virtual reality or the what we call VR. So now that we have VR, medical practitioners can teach themselves on how to identify and visualize different parts of the human anatomy. And also with that, they can be confident to do certain procedures like different surgeries on their simulatory patients without actually doing it on their real patients, so that they can be confident without the pressure of having an effect to their real patient. And next to that is how ICT conforms to the Health Insurance Portability and Accountability Act, or the HIPAA, and also the data privacy. With their innovation of having firewall and also antivirus software, this requires the hospitals to have this so that they can secure the large volumes of patients' identification and information that they hold as their patient stays inside of their hospital. And next with that is what we call the remote results. With remote results now, the patients can see the results of their laboratory tests in their clinic, So without actually going to the clinic again. Also, looking back on the year 2020, I know that we all encountered the application StaySafe.ph. This is the app that the government asked us to download on our devices, so that every time we go to a public place, we can just scan the QR code and we can register ourselves that we really went to that place. And if a situation happened, like someone that we went in that public place contracted COVID, then they can contact us to monitor ourselves with the signs and symptoms related to coronavirus. And when we see early signs and symptoms, we can just isolate ourselves to prevent spread of this virus. So thanks to ICT for this innovation.
Despite of those benefits, there are still quite a few challenges and barriers and limitations that are slowing things down. So let's take a look at them one by one. First is system-related challenges. There are reports that healthcare workers say that they actually feel more stressed and overloaded because of those systems, because there are many systems that are not user-friendly and some crashes often, and others are just poorly designed. So a common complaint is that some feature lacks proper documentation feature and security features. That is, nurses often struggle because they don't have reliable way to write their nurses notes on that system or software, because nurses notes or progress note is a crucial note for this field. Next, we have infrastructure limitations that includes internet connectivity. So we all know that in the Philippines, we have slow or unstable internet, which is a real problem. So a lot of healthcare software today needs to be online at all time. So when the internet goes down, workers can't access important data or use the system properly. That delays patient care. Third on the line is privacy and security issues. This is a big issue that including data security. So storing patient records digitally makes them more vulnerable to data breaches and hacking. And some systems don't have strong encryption, or they have weak access controls, or they're just not properly set up. So that means sensitive information can easily fall into hacking or breaching, which is a serious concern ethically and legally. Fourth is financial constraints. Setting up and maintaining an ICT system isn't cheap, but and in a country like in the Philippines, where healthcare budgets are tight, it's hard for some facilities and hospitals to afford good systems or softwares. So the cost of equipment, software training, and maintenance adds up quickly. So without proper funding, some hospital and clinics just can't keep up with the technology advancement. For fifth factor is human and cultural resistance. So we can't ignore that humans have preferred way to do their work. So some healthcare workers, especially those who have been in the field for a long time, are used to traditional and paper-based methods. Means that they're not always comfortable switching to digital systems. So on the other hand, younger professionals are more techy and prefer digital tools. So when both methods, which is digital and manual, are used side by side, it can lead to confusion, inconsistent records, and miscommunication among healthcare teams. Lastly is ethical and legal implications. All of the stated problems from 1 to 5, from system failures to security lapses, can lead to ethical and legal issues. So for example, if the system that we use crashes, caused a delay in treatment or a mistake in documentation, it can result in patient harm or even legal action. And if patient's privacy is compromised, there is another serious ethical violation again. So while ICT has the potential to make healthcare faster, safer, and more efficient, we can't ignore the real-world challenges that come with it. So we need to improve our systems, upgrade our infrastructures, train our staff, and invest more on security.
ICT enhances quality, accessibility, and efficiency of care. For the key tools that we utilize, we have electronic health records or EHRs, telemedicine, use of mobile apps, and also virtual simulations that we do have in our present time. Through these virtual simulations, it enables accurate, timely, and patient-centered services. Next, as a nursing student, again, ICT supports evidence-based practice and better outcomes, just like what I've said. And the next is for the challenges that we have foreseen. First is the system errors and poor interoperability. Next is, of course, the data privacy and the security risks. Next is the high cost of setup and maintenance in order to achieve the usage of technology within the medical field. And next is resistance to change from some professionals. The capability of other professionals to adapt to the situation wherein technology is utilized with the mode or forte of their work. And next is, of course, the major issue, which is the weak internet infrastructure, especially in our country, which is the Philippines. And of course, moving forward, it needs further policy support, training, and of course, secure our infrastructure for a better network connection. Also, future nurses must be tech aware and adaptable to the situation. And lastly, embrace ICT for safe, efficient, and compassionate care. Thank you.